It's been 20 days since the Omicron variant was found in the United States. It's now the dominant variant. It's accounting for almost 3 out of every 4 infections. Omicron was identified in Wyandotte County Monday. The 2 people testing positive were both fully vaccinated. The Unified Government Health Director is encouraging people to get the booster shot, wear masks in public, and continue social distancing. Also, the Kansas City Chiefs continue to be impacted by the rising cases. Travis Kelce, Harrison Butker, and Chavarius Ward have all been placed on the COVID list. Well, according to reports, their symptoms are mild. Meanwhile, President Biden is set to make a major announcement this afternoon about dealing with the COVID surge this winter. ABC's Celia Vega explains what we can expect.
Today, President Biden set to lay out in stark terms what's at stake as the Omicron variant sweeps the nation. Get vaccinated and boosted now or be prepared for the worst. A White House official says the president will announce drastic new steps to fight the surge. 1,000 military medical personnel deployed to help overburdened hospitals. That's nearly a 5-fold increase to the military doctors, nurses, and paramedics already pitching in. FEMA called in to set up hospital overflow sites, distribute supplies like ventilators, and deploy ambulances to transport patients from crowded facilities to those with open beds. New federal testing and vaccination sites starting in New York City, where in some spots testing lines stretch down the street and people wait for hours. And the president will also announce free at-home rapid tests for any American who requests one. The White House procuring 500 million tests, promising that come January, anyone who requests one through a website will get one in the mail. So what will the president's announcement not include?
Should Americans expect any new restrictions?
This is not a speech about locking the country down. This is a speech outlining and being direct and clear with the American people about the benefits of being vaccinated, the steps we're going to take to increase access and to increase testing, and the risks posed to unvaccinated individuals.
President Biden is scheduled to speak at the White House at 1:30 Kansas City time. Stay with KBC and KCWE for updates. Also, Moderna is working on a booster shot that targets variants. And Omicron-specific booster is expected to be in clinical trials in early 2022. For now, Moderna plans to focus its immediate efforts on advancing the current booster that's already available. The shot is authorized for emergency use and administered as a half dose of 50 micrograms. ICU beds are filling up fast in our local hospitals. Here on your screen is a look at availability of adult ICU hospital beds in Kansas City and its 9 surrounding counties over the past year. In December of last year, when people were starting to get vaccines, 13% of ICU beds were available. Available beds went up in the spring as more people got vaccinated. However, on Friday, fewer than 13% of beds were available. And some local doctors were asked about the possibility of asking for help from the National Guard, as hospitals in other states have done.
The struggle is going to be if a lot of our staff gets sick with Omicron or something else, we may have to turn to that. But remember, too, the National Guard's pulled nationally and in many areas.
They're utilized everywhere right now. I mean, the National Guard's being deployed in so many areas across the country that there's only a finite number of them, too. And so when you have a finite resource and yet your need is way beyond that finite resource, including the National Guard, including all of these measures we look at with staffing and a disaster crisis, we're not going to win this. And so we need to start doing what we can so we don't get to that point.
Hospitals in Ohio are getting help from more than 1,000 National Guard troops, including nurses, EMTs, and others with medical training. Well, if you were looking for a way to be safe before the holidays, you might try an at-home rapid COVID test. Our KBC9 News investigative reporter Matt Fleener has a look at supply and demand.
We're along Independence Avenue, and we started today with a simple question. How long would it take us to find an at-home COVID test? We started just after 10 this morning. Our first store, the CVS, close to downtown. After a quick question to store staff, no luck. Just down the road at Spolito's Pharmacy, we learned they don't stock the at-home tests. So we went next to this Walgreens in the 5400 block of Independence Avenue. We turned up 0 for 3 in 30 minutes.
I mean, it's good. Price Chopper has it.
But good news came at this Price Chopper not far away. We found several tests in stock for just under $20.
It's just my little family, so we don't worry real much about it.
Customers like Bobby McCaslin said she won't need a test this holiday season, but was glad to hear Price Chopper had them. This CVS right across the street had them too. In all, 2 of 5 stores along Independence Avenue had them. It took us less than an hour, with hope it doesn't take you even that long right before the holidays. Matt Fleener, KABC 9 News.
Price Chopper said it's trying to keep tests in stock as much as possible. Walgreens and CVS told us that you can check inventory for tests online. And then new today, Walgreens, by the way, has instituted a 4-item purchase limit for at-home COVID-19 testing products.